All right. I'll get quicker at this, I promise. All right. So today we're going to be covering, well, this week we're going to be covering physiological psychology. Now, in previous lessons, we talked about how there's a difference between the mind and the brain, right? Did we cover that? What's the difference when we say mind versus brain? What are we talking about? Right, physical brain, like being the organ, right? The actual organ. So when we're talking about thoughts and emotions and mental health issues, we're going to get into that. But it's important to understand how we get the outside world into those thoughts and into those memories and form memories and learn from our environment, right? The only way that we can do that is really understand the physical organ of the brain and how neurons are developed and how they form and create neural pathways, which in turn fire electrochemical impulses that just wires our brain so we can experience what we're needing to experience. So to that end, we're going to start with the very basic element that causes this growth, this chain reaction, which is the neuron. Okay, so the neuron is the building block for everything that we are, and how we think, how we exist, how we feel, everything, how we move. Okay, how we receive like pain or taste or whatever. I mean, you name it. Our whole experience is based on neurons. That screen is so crooked. Oh God. Is that bothering anybody else? I don't want to move it. It's going to come down crashing. They're going to take it out of my pay. All right. So, yeah. I am. Mm-hmm. You can. Yep. Absolutely. Yep.
I know there was more than one person.
Okay. All right. Yeah. Because I mean, this is so. I'm not going to get really in the weeds with this because we're not doing biopsychology. Okay. If you want more of this, I don't know if we offer a biopsychology course or not, but the biopsychology would be more geared for somebody that's going into like a neuroscience or something like that. Okay. So I know your book probably went into it talked about potassium and sodium and the electrochemical process, right? We're not going to go too much into that. I want you to, I threw in a few cute little graphics in here just to kind of show you how it works, but I'm not going to go into the chemistry of it all because I think it's way too complicated. So, but at the very basic level, we have the neurons, and we're born with, let me ask this. Has anybody ever heard, I may have already covered this in the course, we only use 10% of our brain. What does that mean? What do you think that means? Yeah. All right.
Only 10% of the processors being used, like a computer. I mean, it's only 10% of it's being used when you're running something.
Okay. So we're only using like 10% of what our capability, our full capability would be. Yeah. Oh. I'm not sure how to get rid of that. Oh, that wasn't it. Oh, there we go. You get rid of send gauge there. Nobody needs to see that anyway. All right. Is that better? Where was I? Oh, 10%. 10% of our brain. I thought you were going to contribute something to that. So anyway, 10% of our brain, we assume it's kind of a cool little thing. We can maybe guesstimate that we have more power than, it's a really empowering statement, right? Or really demeaning, depending on who you are. But if we only use 10% of our brain, that means we got like 90% that we can do other things with, right? That's kind of the assumption we make. Very interestingly, though, we use all of our brain pretty much all the time, even when we're sleeping. In fact, I think we use more of our brain while we're sleeping, believe it or not. But where I think that came from is when we're born with 200 billion neurons in our brain, all packed in, ready to be expanded and ready to go, right? So right day one, actually pre-birth, we're born with those neurons. And what happens over time is we don't use all of those neurons. They're just building blocks. And if they're not used, they're pruned and they're flushed out of our body to about the age of death, somewhere 70s, 80s, 90s. It's estimated that we have about 20 billion. Okay, so from birth to death, we've only used about 10% of our neurons. So I think that that's where that came from. Yeah.
Does it decrease whenever people have Alzheimer's?
Does it decrease?
Yeah, do our neurons?
Doesn't decrease. Alzheimer's is a different animal. Yeah. We lose functioning, but we don't necessarily lose neurons with Alzheimer's. Okay. There's a lot of stuff that goes on with Alzheimer's. The ability to process is still there. It's one of those things we haven't figured out how to stop. Yeah.
Video of a guy in some facility. He knew how to play guitar really well. Like, he couldn't remember his son's name.
Yeah.
I don't understand how that works.
Mhm.
It's complex as that. They can't remember basic stuff.
Yeah. There's a lot of association that we're learning as far as cognitive abilities and being able to help somebody with. Has anybody known anybody with Alzheimer's? Okay, quite a few of you. It's a scary thing, right? It can be frightening not only for the family, but it for the individual themselves. I've had two grandparents that suffered from Alzheimer's, and it's sad to see their cognitive abilities kind of diminish over pretty rapidly for some people, pretty slowly for others. But anyway, so they're not losing neurons. What they're, we'll go into what Alzheimer's is a little bit later. But anyway, so the neurons build up and they form neural pathways. Just a point on glia. These are cells that support the neurons by helping to insulate them. We'll get into what that looks like here in a little bit. But they're kind of the support function for the neurons. So the neurons are the workhorses. The glia just helps to kind of support them. They get them where they need to go. They protect them. Kind of the transports. The Navy or the Air Force for the Army, I guess it would be a good term. All right, so we have three really basic parts to the neuron. We have the cell body, which I think your book might refer to as the soma. Okay, the cell body is responsible for pretty much. It's the director. Okay, it's got all the instructions that are needed for what the function of that neuron is to do. Okay, so that it could be a detection of an electric signal that comes through it, and it says, okay, I'm not going to fire until I get so many signals. Or if I get so many signals, I'm actually not going to fire because we've got another priority that we need to be paying attention to. And what that looks like, and we could have inhibitory cells. Okay, so inhibitory cells would be similar to, like, if we need to prioritize. So how many of you ever had a paper cut? Pretty bad, right? Especially if you get what in it? Like salt. Salt's a good one. Anybody ever like cut a tomato and get it? Oh, yeah. Or jalapenos, even worse. Okay, or peppers, hot peppers. So it burns. It's pretty painful. Now, if you had that paper cut, and say you get that paper cut, you get tomato juice in it or something, and you're like, oh, that really hurts. And you go up and you kick the leg to your table and you stub your toe. What do you think you're going to feel? That paper cut's not going to burn so much anymore, right? And that's because of these guys here. They're the directors. They're saying, hey, whoa, don't worry about the paper cut. We've got another major thing going on, because our feet, we really have to protect our feet, because that's how we get around, right? That's how we survive. So anyway, some of these might have instructions to wait for higher priorities to come through. So that paper cut doesn't really hurt anymore because we've got something more important going on. So anyway, that's the cell body. Outside of the cell body, we have these little tentacle things called dendrites. Now, these dendrites are the connectors. they fire off into other cell bodies, into the post neuron, okay? So we receive a signal through here. The cell body decides what we're going to do with that, and then it fires off into the dendrites, which go into other cell bodies, okay? So what we have here is basically the highway. This is the wire that carries that signal from one end to the other. I guess the best way to really demonstrate is light switches, right? So say I turn off a light switch, okay? It's kind of sitting in its resting state. And let's see. Sierra, go ahead, give me the command to turn on the light. What's that? Turn it back on. Okay, so she said, turn it back on. I, as the cell body, the soma, I'm gonna say, okay, we're gonna fire this off. And it did. And it carried that electrical signal to those lights, which the light said, okay, we're going to create light, okay? So a lot of things happen just in that one moment. And that's similar to what we have here. Now, if you can imagine this happening millions and millions of times until that gets, you know, that from your toe to your brain, that's pretty impressive, right? So anyway, the axon is basically is just the wiring that carries that. Now, if you'll notice around here, it says myelin sheath. What does your book say about the myelin sheath? Anybody read up on that? It's insulation. Yeah. Yeah. That's where the glia comes in. It helps to form the myelin sheath, which is just an insulation. Okay, and we want that in some important functions. We do want that for a couple of reasons. First of all, what happens if you have two bare wires touching each other? They short out, right? If you have a signal going through one, it's going to go through the other one. We may not want that. Sometimes it does happen. Yeah.
Part of the reason, has anybody ever heard of rabbit starvation?
Rabbit?
Rabbit starvation. All right, so it's a dietary problem that people have. Basically, they eat all the rabbits they can possibly want. It's just like trappers and stuff. You don't have fat in your diet. Eventually, you run out of fat.
Oh.
You run out of fat because
Right.
you don't have it for your brain.
Okay. So building blocks. Yeah. Absolutely.
So basically, you starve to death.
Okay. So you're missing important building blocks.
Yeah, you have to have fat in your diet.
Right. Okay. And that might be a problem with that. So like I said, sometimes our wires do get crossed. For me, maybe some of you can relate to this. Like when I'm cleaning my ears with a Q-tip, my belly button tickles. Yeah, I don't know why that is, but that would be an example. I mean, does anybody else have an example? Like if you pinch your toe, something else, your ears wiggle or something? I don't know. Anybody have anything? No crazy. Am I the only one that has something weird like that? What's that? You're gonna have to think about it. Okay, well, if you think about it, let me know. But anyway, that's what happens when we don't have insulation. And in some functions, and we're not going to really cover any instances until we get into sensation, which will be next week. But you know, that happens. But for the most part, we have to develop that myelin sheath in order to protect those functions. So this is what it looks like. So we get that electrochemical signal that comes through the axon from another cell or a sensory receptor. And that soma says, okay, well, we got this now it doesn't necessarily, again, sometimes it stops right here. The soma will say, we're not to fire. We're not going to do anything because this might be an inhibitory neuron, okay? But this is normally what happens. So how do we get these electrochemical impulses? How do they fire? And again, this is kind of where you saw the potassium and the sodium. And again, as Ken pointed out, that's something that's really important in our bodies, because what happens if we don't have an adequate amount of sodium or electrolytes in our body? This can't happen. So what happens if this can't happen? What happens to our cognitive functioning? Yeah, yeah. We can't pay attention. We probably we're gonna have problems with memory. Okay. May even have problems walking. Our system shuts down if we don't have sodium, right? So anyway, just put that as a little side note. So what happens is just a reverse of poles, and it carries that action potential through the body, or through that axon, okay, to wherever it needs to go. Now, this is an all or nothing. There's no degree. And when we get into pain receptors, I'll kind of explain this a little bit more. But there's no intensity in this electrical signal. Okay, it's like 0.05 milliamps or something like that, or millivolts or something. It's really, really hardly detectable, but it is present. So when it's all or nothing, there's really no degree. Now we can have multiple neurons firing. Like if we have multiple pain receptors being activated, that's going to tell our brain, hey, whoa, something's happening. But if we just get like a little pinprick or something like that, just one of those, just maybe a couple of those neurons firing, that's not that much. Our body's just saying, hey, you know, what's going on down there? And you become curious as to what's happening. Yeah.
Another thing you mentioned, anybody ever been hit with a shock prod?
Hit a shock prod?
Shock prod.
Like cattle prod or something?
Yeah, I'm just kind of devastated what you're talking about.
Okay. Well, yeah. You got a lot of things going on there, right? And we'll get into pain receptors here in a little bit. So I always look at the all or nothing law as similar to a toilet. Like when you flush a toilet, what happens with a toilet? Does it kind of just go down? Sometimes, okay, depends on what you did in that toilet, right? Or put in that toilet. But the principle of it is when it fills up with water, it creates a negative flow and it drops down through the pipe. There's no flap in that pipe or anything. It's got a little trap, a P trap. It has nothing to do with pee. But once it gets to a certain level, it sucks the rest of it down that pipe. Okay, so it's all or nothing. And again, I'm not going to really go into, this is just a kind of a description of how the sodium ions reverse charges with the potassium to help that charge flow. All right, so this is, again, I like the little graphics, but if you can look at these are the sodium ions here, that they're sitting at a nice resting rate. And then when that charge comes through, they collapse. They collapse within that ion and help propagate that electric charge through there, okay? All right, so just quick little check. So which of the following helps to synchronize activity among neurons and assist in the formation process? Who's brave? What do you think? Yeah, glia, absolutely. Good job. All right, remember, that's just the assist. It helps with the fatty tissues and yeah, kind of the supporting role. All right. So another important structure that we see within the neuron is called the synapse. Now, the synapse equally is important because we have the soma, the cell body, which tells it what to do. But these synapses have a very important function because they not only help to transmit the signal, but this is where they can be interrupted. Now, what do I mean by that? What can interrupt? What can interrupt neurotransmitters? What's that? Heavy metals?
Yeah, we get into the neurons.
Okay. Maybe that's kind of like a malnutritional thing, but maybe, yeah. Really anything. Drugs, for example, right? Drugs could have it. Disease could affect that. Some kind of disease that affects how those neurotransmitters flow. So within the synapses, and I'll show this on another slide, but we have the terminal button, which is the presynaptic ending. That's where the neurotransmitters are released through vesicles, which I'll show you. We have the neurotransmitter, and these are different chemicals. We have probably around 40 or 50 of these chemicals within our body. For the purposes of psychology, we only look at about maybe 12, seriously. And again, we're not dopamine. You probably heard of dopamine. What's dopamine do for us? What's that? Happy, right? It's a reward one. It's a dopamine is our reward chemical, and you'll hear that implicated in a lot of things, such as addiction, right? Such as satiation from hunger. You know, dopamine that some of us maybe, I know I do, sometimes stress eat. Okay, our dopamine is activated. It's making us feel rewarded when things maybe aren't so good. But yeah, dopamine, we'll talk more about how that feeds into addiction here, hopefully in a little bit. Serotonin, you may have heard of serotonin, right? What does serotonin do for us? Makes us happy, right? What happens if we don't have serotonin? Right. So if that flow of serotonin is interrupted, we could experience depression-like symptoms. Okay. So that's important as clinicians. Maybe that's something that I want to find out is what's happening that serotonin isn't being produced. Is it something in the diet? Is it maybe chemical, or is it something environmental that their serotonin isn't being activated? And then you have your postsynaptic neuron, which is basically just the receiver. Okay. So this is what it looks like. So the synapse is really the junction. You're going to find that in between the dendrites and the terminal or the postsynaptic neuron dendrites here. Okay, so what we see here is we have the impulse that's shot down into these vesicles, and these vesicles kind of circle around here, and each vesicle is just basically kind of a bus with a bunch of little with the the neurotransmitters in there. And once they scoop around here, they release those neurotransmitters in across the synapse. And again, there's a space in here that makes us vulnerable to receiving other chemicals in here, which could interrupt that flow. And then, of course, the postsynaptic membrane is what's going to accept those neurotransmitters. Okay. So this is kind of what it looks like. We have the action potential fires down, and it activates those vesicles, and those vesicles release the neurotransmitters across the receptor. Okay. And really, that's it. That's how the transmission occurs from one neuron to the next, happening hundreds of thousands to a million times just for one little impulse, one little activity that's going on. Another depiction of what that might look like. Okay. All right. I'm not going to go. We didn't actually cover that. All right. So the myelin sheath, which we talked about, and I think I spelled that incorrectly up there. Yeah, it's not. Anyway, so the myelin sheath does, again, what we talked about is it helps to protect that action potential. To not only makes it a faster transmit, but keeps it from being degraded in any way, keeps it from being interrupted. Because again, if you have wires crossed that are unprotected, you're going to short something out. Okay. So this is kind of what it looks like. This is definitely not. We don't have any scopes that can actually see this happening, but this is definitely an artist's depiction of what occurs. Okay, and constantly firing. You just see this happening throughout your brain. It's happening a million times right now as you're putting up your hands. Yeah.
So what happens during paralysis?
During what?
Paralysis.
Paralysis? Yeah. Well, it depends. What kind of paralysis?
Okay. Spinal paralysis where let's say my lower half.
Okay. That's a physical severing of your spinal cord or parts of your spinal cord.
So with my neurons like this, it's being completely shut down since I can't feel anything.
Right. You snap that wire. That nothing can be transmitted over that wire. Sometimes it can be repaired. Oftentimes it's not. Okay.
Okay. I'm hoping this is getting off topic, but the reaction that actually happens with the neuron. Correct me if I'm wrong, but my assumption is that the neuron takes the sodium, right? And then the reaction occurs with the
So,
Or
so
is there another cell that's responsible for? I'm just trying to get my head around it.
okay, so this is connecting to another one of these, and this is just happening millions of times throughout your body. So when you get, say, a pinprick on your little toe, it's firing a signal all the way up your leg, all the way into your spine, into your brain, a million times of these. That's happening. Okay. And something in there is saying, yes, fire, yes, fire. Now, say you stub your toe and you got a pinprick on your right little toe, and then you stub your left big toe. This side is probably not going to fire so much, because somewhere in your spine, it's gating it and it's saying, hey, we got something more important going on over here. So the function of this changes. And this, and again, this just happens automatically for many of us. You know, it's in our genes that it occurs this way. But the sodium, the only thing the sodium's responsible for is moving that along. Okay. So without sodium, without electrolytes, again, we're going to see that signal is not going to propagate the way it should be, because that chemical reaction. It's kind of like a battery. Okay. A battery is not an actual, we're not cranking anything, right? It's not electromagnetic, it's electrochemical. What is it? Sodium phosphate, I think. I can't remember the chemicals that are in there, but the two chemicals that are reacting to each other is creating an electrical signal. That's electrochemical, and that's almost identical to what's happening within our axons. Okay, so what's happening, Ken, and for the rest of you, is once it gets to these terminal buttons, it's releasing those chemicals like serotonin and dopamine and acetylcholine and norepinephrine, or whatever the function of this is, it's releasing those. Okay, and I'll talk a little bit more when we get to how those can be interrupted. But Hunter, just kind of follow up on what you said about what happens during paralysis. There could be different types of paralysis. All right. If we have a problem with myelination, that might be an indication of multiple sclerosis, right? MS, right? That's where you start losing function, maybe feeling. When we have a stroke, you're not losing neurons. You've probably killed some brain cells, and they're no longer connected in a way. So it's not really a severing of a spinal cord or something, but it's definitely within the brain that we've severed those connections. And sometimes you can rebuild them, and sometimes, you know, it doesn't happen as quickly or at all. During sleep, we go into paralysis when we go to sleep. Did you know that? Our mind is very, very active when we're sleeping. But when we when our bodies are trying to mimic what it is that's going through our thoughts and going through our memories or brains or whatever, that would be a problem if we started walking around and trying to act some of those out, right? Imagine that you're running away from a monster or something in your dream. Is that wise to be doing that, running around while you're dreaming these things? Probably not. It's not safe. So our bodies have adapted to shutting down, to paralyzing our body during those moments. And we'll talk about that when we get into dreams, sleep and dreams. Okay, and here's another kind of cool one. I just love the graphics. All right, so neurotransmitters and behaviors. Again, we're not going to go through all of them, but we're certainly going to talk about a lot in this class. We're going to talk about serotonin. We're going to talk about acetylcholine, which is responsible for sensory motor. We're going to talk about dopamine, which is, again, our pleasure, a reward chemical. Norepinephrine, you know, we've got glutamate. We've got a lot of these neurotransmitters that are responsible for very different things. Let's see here. I'm here. All right. So any questions so far? I know I kind of breezed through neurons and neural functioning. How are we doing? Is it a lot? Okay. All right. If you can just take, you know, the neurons are the building blocks, and how they function in the synapses. That's kind of the important stuff that's going to help you understand not only things in this class, but whatever else you're going into that you're going to be talking about, like anatomy or biological functioning or something like that, okay? Because this really affects everything. It affects, it's how we move, again, how we move, how we think, how we breathe, our autonomic functioning. It's really applicable to everything that we do. And I think it's really cool, isn't it? That we've developed this intricate system just to, for Hunter to sit there with his arms crossed, right? There's like billions of things going on right now that put him, whatever you're thinking right now. So anyway, any questions? How are we doing? Okay, thumbs up. We still alive? All right, all right. So let's take a moment and talk about how these processes are interrupted. Now we're going to go into drug addiction a little bit later in this course, but because it's a problem. It's we talk about identifying problems in society. Drug addiction is one of those, right? Maybe some of us in here have some kind of addiction. I know mine was coffee. How many of you like coffee, by the way? Okay. How many of you can't live without coffee? What happens when you don't have coffee? Headache?
Really, really grouchy.
Grouchy? Okay. Okay. So funny little story for me. So many years ago, when I was a therapist, I was seeing like anywhere from 6 to 10 clients a day, which is a lot. In order to keep awake, I would drink coffee throughout the day. And I didn't drink it on the weekends because, I didn't really need to be up and seeing 10 clients throughout the day. So I did this for about a year. And then I started experiencing like depression on Saturday. I couldn't get out of bed. It was just like, I'm like, there's got to be something wrong. And then on Sundays, I would experience the headaches. I did this for like almost 2 months. And eventually I just kind of started looking into it, thinking maybe there's something wrong with me. Put it 2 and 2 together and realized that it's because of coffee. I wasn't drinking coffee on the weekends, and coffee is a stimulant, which we'll talk about, and it excites your system. It feeds your dopamine, increases your serotonin, and when you don't have that, your body says, "Oh, wait a minute, I don't know what to do now." We weren't firing serotonin because we didn't have to. We weren't firing dopamine because we didn't have to. So when your system is trying to bounce back from that, it's not used to working and it stops functioning. And when we don't have serotonin, we don't have dopamine, what happens? Get depression, right? So that explained what my Saturday blues were. And then of course, my headaches was for something different because caffeine constricts your blood vessels in your head. And when you don't have caffeine, it opens them up. And now you just have like this firing of blood, which explains the headaches. Anyway, fun little fact. Anyway, so drugs. Talked about stimulants, increase energy, alertness, and activity. They block protein to presynaptic neurons. So what are some, well, I gave you some examples of drugs. So caffeine, cocaine, nicotine, okay? How many of you, well, you don't have to answer if you don't want, vape or smoke? It's a stimulant, okay? What does nicotine do for us? Why do you think people get addicted to nicotine? Ritual, okay, so behavioral. Calm you down, okay. Does it calm you down?
So I've heard.
What's that? Heard somebody say something.
So the ritual.
The ritual might calm me down, okay, okay. So how many of you are aware that ADHD is treated with a stimulant? Okay, why? Why is that? Okay, okay. What is ADHD? What happens with ADHD, mind versus body? What is ADHD? Yeah. Attention deficit hyperactivity disorder, right? So within ADHD, and we're going to cover this later too, but this kind of illustrates what we do with stimulants. So with, what time do we? 10:45, right? So we're done. Okay, good. So with ADHD, the person's mind is constantly firing, okay? Having a hard time focusing, having a hard time tracking, having a hard time remembering, and they're just all over the place in their mind sometimes, okay? It's a lack of organization. Sometimes they might have hyperactivity. So what happens in those moments is their mind is going so fast that it can't keep up with their body. So what does a stimulant do? Increases your body. So now we have our mind operating at this level, but our body was down here with the stimulant. Now we have both kind of at the same level, and the person can find themselves to be a little bit more focused and energetic to keep up with their mind. Yeah.
So going ahead here, why can't marijuana be a stimulant?
Why can't marijuana be a stimulant? Why can't it be?
Why can't? Yeah. Considering it kind of does the same effects as the stimulant.
Uh-huh.
And how it's working.
Well,
Why does fall?
it actually retards your system. Yeah. So it has the opposite effect of that. Right. So if somebody has an active mind, and sometimes this works, sometimes it doesn't. Say they have an active mind and their energy levels here. What the marijuana does, it actually brings you down. It's not a depressant per se, but it kind of levels you off. And too much THC can do what? Yeah.
Honestly, the answer for the whole marijuana thing, there's so many different things that actually happen with marijuana that you can't really, I mean, even just throwing it into a classification is kind of an asinine thing. You consider how many different things are going on.
Yeah.
I mean, so you can't really call it a stimulant, you can't call it a narcotic. The government never knew what the hell to do with it. So,
Well, that was actually political. Kind of getting a little political on you here. So why were drugs made illegal? Does anybody know? Does anybody have Netflix? There's a great documentary on Netflix that kind of describes how drugs got their classifications. It really happened back in the 60s and 70s, when the war was going on and people were anti-government, anti-war. They were prescribing stuff to themselves like LSD and marijuana and cocaine. So to combat that, the government said, all right, well, we're going to classify this based on what we think is the most addictive, and made them illegal. And depending on what you had and how much you had, developed whether it's a misdemeanor or a felony for possession or distribution. Okay, so we lived by that for many decades, for several decades, and now we're just starting to scratch the surface on the benefits to some of these narcotics, right? For example, marijuana, not necessarily marijuana, but CBD and THC, right? We're starting to recognize that there might be some value in that. LSD, we're finding a comeback with LSD. LSD was kind of like the big no-no, right? We weren't allowed to even talk LSD because it was that illegal, it was that potent and that addictive. But that's what we had to believe. Yeah.
I'm waiting for the study to come around for the ecstasy and PTSD.
Yeah, it's already out there. Yeah, Sierra.
There's some studies on how to use like people with severe
Yeah.
There's a documentary or like a docu-series on Hulu. It's about this. It's chemist that studies like drug compounds and stuff, like how they function in the brain. And he did an interview with a lady that treats her patients with like extremely small doses of ketamine to help them be able to
Yeah.
these parts of their brains that they wouldn't talk about.
Yeah. Yeah. Y'all, I don't know if you all heard that, but they're looking at ketamine and what's the LSD? Not ketamine. Psilocybin, right? Is that right? Is that's the chemical that's in LSD? But looking at doing very small doses to help people get out of whatever cycle they're in their brain. Maybe they don't want to talk about something because they've gotten this cycle that if they talk about it, it's going to be painful, or they're going to be judged, or something happens that people don't want to talk about things. So they're finding that chemicals that are in LSD and ketamine help to break that cycle. It can help break opiate addiction. And again, I'm not professing in any way go out and do LSD if you got issues. I'm not saying that at all. But what we are seeing is that in clinical settings in very small doses, it can be helpful. So we're finding this stuff out. Yeah.
I read somewhere that LSD was originally being researched alcohol.
Well, I don't know if it was. I know it is now.
Really?
They're looking at it now. Many addictions, a lot of addictions. Because what are addictions? What are addictions? They're cycles, right? They're cycles we get into because it boosts our dopamine. We feel good about it. We're either trying to mask something that feels really bad, or we're trying to reward ourselves for something that feels really good. We get into that cycle. And some of these drug therapies might be able to help break that cycle, right? Hey, gosh, I go off on tangents. So anyway, this is what happens just with stimulants such as cocaine. All right. So you have your terminal button that's sending, again, this is your synapse. You have your terminal button that's sending the neurotransmitters to the receptor sites. Okay. So what's happening when cocaine, the stimulants that are in cocaine come across this receptor because it's in our bloodstream, it starts blocking the reuptake of dopamine, saying that we don't really have to use so much dopamine. This doesn't have to produce so much dopamine because these are just floating around in here. So what should be happening? Let's see if there's a way to, I think I have it on a later slide. These neurotransmitters, when they're not used, they flow back up into the terminal button, okay? And they get reused. Nothing is ever wasted unless they hang out here too long, and then eventually they're dissolved, okay? So the proteins will break them down. So what's happening here is dopamine is coming down out of the terminal button, and it's just hanging out here extra longer, given this receptor site the false idea that there's a lot of dopamine being fired, okay? It's not doing what it's supposed to be doing, firing, receiving, and then going back up there. It's firing. These are the terminal buttons getting blocked for reuptake, and it's just hanging out here, the dopamine neurotransmitters, okay? So again, this is just kind of like a graphic of what's occurring. Hallucinogens, we talked about LSD, right? Hallucinogens, they low doses, they increase arousal. High doses, they can cause hallucinations, okay? So again, too much of a good thing could be a bad thing, right? So if we're looking at this, if we're looking at LSD or ecstasy or whatever, whatever the active ingredient is in ecstasy, those can be helpful, but too much can create hallucinations. Why do you I don't know, what do you think? Why do people aim for hallucinations?
I don't know, what do they hallucinate? Like, what are their hallucinations?
Hallucination could just be like distorted images or distorted sound. Yeah.
Well, I'm thinking like maybe hallucinate like.
Okay. So they might have, so it might distort their sense of reality. So somebody they miss might be in their head or something, right? So the fascination with hallucinations is that you're thinking outside of how, again, you've broken that cycle. You're thinking outside of how you normally think. And when hallucinations occur, they can occur either auditorily, which means we hear things that aren't there, or things that we do hear are distorted. Or if we see something, we'll see something that's not there, or we'll miss something that is there, or whatever is there, we might distort it in some way. We might see, I could be looking at McKinley back there, his head could just like be blown up like a balloon or something if I was hallucinating that, right? Sorry to pick on you. So anyway, hallucinations, they operate a little bit differently. They don't block anything. They attach to the neurotransmitters, and they actually mimic neurotransmitters. Okay, so going back to what we would see here. Actually, I don't have a slide for that. So what would happen? We wouldn't see, this is cocaine. Don't pay attention to the little white ones here. So what we would see here is, if this is LSD, they would be coming across here and mimicking these neurotransmitters and filling in these receptor sites, okay? Because they mimic. It gives the impression that there's more of those neurotransmitters than what there actually are. All right. Western cultures. I'm trying to see if there's anything here worth. Okay, we talked about that a little bit already. All right, any questions up until this point? Or any comments? Is this all making sense? Okay. All right, so other commonly abused drugs, depressants, alcohol. Question: why do we look at alcohol as like I've heard it called a social lubricant? Why do we look at alcohol as like a social, I mean, what is social about alcohol, do you think? True personalities come out. Why is that? If it's a depressant, what happens with the depressant? What's that? Reduces your inhibitions. Okay. Okay. So if somebody has anxiety, we want to give them a depressant, right? That's probably makes a little bit more sense, because we know that depressants kind of lower the autonomic functioning body systems, right? Kind of reduce our anxieties a little bit, bring our heart rate down, right? Slow down our thoughts. So has anybody seen, I think Hunter, you kind of alluded to it already, somebody that drinks alcohol, they become a little bit more activated. They kind of wake up, right? Yeah.
Not to get into another damn army story, but here it goes. All right, so used to have to try to figure out what's wrong with people. So sometimes if you had a lot of problems going out with people, I would sometimes get a few drinks into them and start a line of questioning and actually find out what the hell is going on.
Okay.
And actually get a lot more information. And some information that you just wish you didn't hear.
Okay. Yeah. Okay.
You know what's going on, so do what you gotta do.
So alcohol reduces their inhibitions, like McKinley said, right? Reduces. Right. Right. I wouldn't recommend that in a clinical setting, by the way, you know, but the idea is actually very similar, and that's why we prescribe antidepressants. I'm sorry. Yeah.
Well, I mean, there's also the social thing. It's just like this is a social situation. We're used to opening up to people.
Okay. So they're.
It still comes into play. You get a few years into somebody, they'll tell you things.
Yeah. Right, right. They're inhibitions. I'm sorry, not antidepressants, anti-anxiolytic. Anti-anxiolytics are depressants because they help reduce those periods of anxiety. Narcotics, okay. Opiates, for example. Opiates are known as painkillers, right? We're all pretty familiar with the epidemic with opiates, right? Not good stuff. Marijuana, you know, we talked about marijuana and THC. A lot of studies are showing that it can be helpful in certain cases. Now, probably, I don't believe it's a catch-all for everything. It's like, you know, again, we don't want to self-prescribe. None of us in here, well, one of us in here are doctors, right? So we don't know the chemical makeups of what some of these things do. And in some cases, it could be harmful. For example, we know that smoking marijuana, while the THC in your body might be beneficial, it could be harmful. It is harmful. Why is that? You're smoking it, right? You're inhaling something that doesn't belong in your body. So you know, that charred stuff could cause emphysema. What's that? Yeah, yeah. Could lead to some bad things. But we're starting to figure that out. We're using ingestibles, right? Edibles now. That are being prescribed. But their THC has been shown to reduce nausea, you know, suppress tremors, reduce pressure in the eyes. Now, glaucoma, anybody that has glaucoma, they'll use THC to help with that. And decrease cell loss after stroke. Because what happens with the stroke, right? We lose part of our brain functioning. And when we don't use that, it starts deteriorating. So we're finding that THC is helpful in preventing that or reducing that. So how THC works is it attaches to the receptors and help to kind of feed back into the terminal button. So again, it mimics the endocannabinoids, right? which are essential for thought functioning and tracking and paying attention, but mimics that and gets into the system this way, and then feeds back into your neuron, your terminal, which again shows that we absorb this into our body and it can remain there for a very long time. Okay, and that's why you can test for it weeks after somebody's actually used it, because it's still within not only their bloodstream, but it's within their neurotransmitters. It attaches to those neurotransmitters. Okay, and things like LSD, for example, they hang out even longer. I think up to a month. I think I've heard. Is that right? Anybody know? Yeah, LSD. You mean?
Any like LSD, acid.
Yeah.
So
Yeah.
if you on that same show I talked about before, then an interview with the guy that made it, and he had like so much in his spine. He just does it every day. That he said, like if he turns his back the wrong way, he'll just start tripping.
Okay. Okay. Yeah. Yeah. So it was in his neurotransmitters. It was ingrained in his neurons, right? And that's what happens when they mimic. And THC can do something very similar, not to that level, but you might know somebody that, you know, I know a couple people. I've worked with a couple people in clinical settings that have been on smoking pot for a very long time in large quantities of it, and they're not right. Okay, there's something off about them, and they're oftentimes paranoid, oftentimes aloof. They're thinking about they have lofty thoughts and ambitions. They're not really based in reality. I see that a lot with people that are heavy pot smokers, right? And maybe you know somebody that's very similar to that. Okay. So again, this is just another graphic of how that looks. EC is endocannabinoid. Sorry, the best graphic I could find was, I think that's in Spanish. Anybody know? Is that Spanish? No. What is it? Yeah. All right. All right. How are we doing on time here? All right. Why does heavy use of marijuana during adolescence put one at risk for psychiatric problems? What do you think? Okay. How many of you agree with that? All right. That's right. And I'll tell you that is, any of you that are going into child psychiatry or psychology, or even medicine, that is probably one of the biggest ethical concerns, is giving children medication at a young age because of that reason, because their brains, their prefrontal cortex has not fully developed. And we're going to talk about this. This will lead us into our next topic for Thursday, is the development of the brain in different areas. Just off does anybody know what the prefrontal cortex is responsible for? Yeah. Personality. Okay. Emotional regulation. Okay. Judgment, development of moral development. Okay, so a lot of your higher functioning things, the things that separate us from dogs and apes and whatever else, that's what really separates us, because we have that ability, we have that function, and that occurs in the prefrontal cortex. And if an adolescent hasn't fully developed that, and now we're altering the structure of that, that could lead to some lifelong problems, right? So we'll talk more about that when we get into development. Any questions or comments? How'd you all like it? Does that make sense? Okay. How y'all feeling? Okay. I don't know how to take the silence, but I mean, a couple of you are participating, but you know, I'm always curious as to whether it's absorbing or if I'm just boring you all to death by PowerPoint slides. Okay. Yeah.
So, but is it a proven fact that children take medication?
Not necessarily. I can't say that I've ever seen anything. So the question was, children that take medication at a very young age have addiction problems later. I can't say that that's definitively true. Addiction is, you'll hear me talk about, and you probably have read, addiction is a disease, okay? And there are many reasons why we do that. And I would say the number one reason is political, okay? Because we have to believe that it's something that's outside of somebody's control. Otherwise, insurance companies don't pay for that. And that could lead to some very bad things. But a lot of it is choice. There is choice in it. And once you're in it, you may not know it. And I'll use my example for coffee, right? I wasn't aware I was in the throes of addiction. I had no clue. It was completely accidental that I walked into it. And it would have been, I took one of two roads with that, right? So what could I have done to alleviate the discomfort and the depression?
Could've drank more, just repeat the process.
I could have drank more, right? I could have, instead of drinking coffee on Monday, I have to make sure I'm specifying coffee. Instead of drinking coffee Monday through Friday, I could have done it Saturday and Sunday as well to alleviate that discomfort, right? And that's the trap that we get into when we talk about addiction. We get stuck in that cycle. Opioids, right? Is anybody familiar with the track of opioids, how it starts? How does it normally start?
Gets injured, they take just a normal painkiller, then they keep on needing it to reduce the pain. Then they think they need it.
I counseled a woman when I was working in drug and alcohol. She was very successful, earning six figures a year, and she had knee surgery back in the 90s, and they gave her OxyContin to help with the pain. Okay. She started taking it and wasn't aware that she was developing a tolerance to it, and started taking more and more and more just to keep the pain from hurting. Before she knew it, she said she was spending $1,600 a month on pills from the street just so she could feel normal. Wasn't aware she was doing. She was making six figures. Who cared? That's what money does. Doctor wouldn't give her any more, so she went to the streets and got it. Started losing functioning at the job. She wasn't nearly as focused anymore because she was jonesing to try and get more drugs and couldn't find a way to do that. So she wound up getting fired from her job, losing her income, lost her family, couldn't afford $1,600 in pills anymore. What do you think she did? What's that? Selling. Okay. Got into some pretty nefarious situations, probably did some things she wasn't proud of to get money, but found what was cheaper than OxyContin on the street. Heroin, shooting heroin. She could do that for a fraction of the price. And she said, never in a million years would I thought that I would have stuck a needle in my arm, but she did. And that's the track of that addiction can take. And she wasn't even aware that she was doing it. She just wanted to function normally. So, but luckily she made the choice. She had lost just about everything, but she made the choice to make some positive changes in her life and do the hard thing and not feed that addiction anymore. So anyway, sorry, that was my little soapbox. Unless there are any other questions, that's all I got for today. Hope you have a great rest of your day. Stay dry. I know it's going to be rainy and windy and whatever else from Hurricane Ida. Hey, Madeline, you still there?
Yeah, I'm still here.
I'm sorry, I lost connection on the computer. Did you have any questions for me?
I did. What is this doing? So on the article review, it says like it should be 1 to 2 pages, but then at the bottom of it, there's like a little